Good afternoon, everyone. I'm going to allow everybody a few minutes to jump onto the call, but thank you all for joining the June Behavioral Health Advisory Group meeting.
Hi, Kimberly.
Hi, good afternoon, Dr. Wiggum. How are you?
I'm fine, thank you. So I'm going to be off camera just because I'm eating lunch.
I completely understand.
Oh,
Thanks for joining.
a pleasure.
Hi, Kim. This is Margaret Fowler as well, and I'm going to be off camera while I eat my lunch.
It's that kind of day. I have mine sitting in a bowl next to me, just looking at me, waiting. All right, I have 2:02, so I think we can go ahead and get started our discussion for the day. Again, thank you all for joining the Healthcare Action Coalition Behavioral Health Advisory Group meeting. Today, for those of you that don't know me, my name's Kim Stinchcomb. I'm the manager of the Healthcare Action Coalition. I am going to be shortly joined by our new intern, Taylor Palmer. Unfortunately, with the rain, she's experiencing a little bit of water entering her house. But in the future, she's going to be taking the lead on our behavioral health advisory group calls. So I'll be excited to introduce her as soon as she's available. And today for our agenda, we'll do our normal introductions and welcome. We have a introduction to Imani Booker Lewis from the local Behavioral Health Authority. And then we're going to discuss the Maryland Consortium on Coordinated Community Supports. We're expecting that RFP to come out shortly. Moving into strategic planning, goals, and a timeline, and then open it up to any community announcements. And it's officially the first day of summer. So thank you all for joining. Again, please go ahead and feel free to put in the chat your name, your organization, and one way that you help others to maintain their mental health. So this could be something that you practice with friends on, a daily basis, or family, or something that's just a more casual thing that you do to practice, or it could be, of course, directly related to your role. And as always, I welcome anyone to jump on and share with the group out loud. But I can go ahead and start. My name is Kim Stinchcomb. I'm with Prince George's Health Department. And one way I help others maintain their mental health, I think, is checking in. I try to check in with my friends, quick phone call, just to see how they're doing and gauge their well-being.
Hey, hello, this is Ken Alford. I was formerly with you guys about probably, I don't know, two years ago. I left the area. I'm back now. I'm now the director of nursing for Recovery Centers of America, Capital Region, and also I'm the chief clinical consultant for Brightpoint. One of the things that I do to support someone's mental health is I give a lot of meditation exercises. I'll have people to kind of deep breathe on the spot, meditate and reflect. I found that that's a healthy way, keeps you mindful of what you're doing and where you're going. So that's one of the things I do to maintain mental health.
Excellent. Thank you.
I can go next. Hi, everybody. My name is Benjamin Pesach. I'm an intern with the Prince George's Health Department. Um, Kind of like Kent said, helping people through breathing exercises, guided meditations. I don't know how I found myself doing that, but it just sort of happened, and it's been wonderful kind of seeing my friends be able to take a moment and just like put their issues aside.
Thanks, Benji. Anyone else feeling in the mood to share out loud today? All right. That is no problem. I guess part of other things I do to check on people's mental health is give them the option not to share. So I'm very excited to introduce our first speaker of the day, Ms. Imani Booker-Lewis, who is our director of the local behavioral health authority with the health department. So Imani, I'll pass it over to you.
Thank you, Kim, and good afternoon, everyone. Hopefully, Kim, I hope you don't mind if I share my screen. I'm just going to walk through a presentation. I'm going to try to be brief. And for those who have heard this presentation before, I challenge you to pretend to be shocked and awed today during this presentation. So just follow along, and if you have any questions, please let me know. Can everyone see the presentation?
Yes.
Yes.
Okay, perfect. Okay, my name is Imani Booker-Lewis. I am the manager for the Prince George's County Local Behavioral Health Authority with the Prince George's County Health Department. So who are we? The Local Behavioral Health Authority, in collaboration with the Maryland Department of Health and Behavioral Health Administration, is a state-mandated program responsible for the planning, managing, and monitoring of publicly funded behavioral health services for individuals across the lifespan. And when I state publicly funded, as many of you know, that means Medicaid reimbursable services within the Prince George's County. We are system navigators. The LBHA is often the first point of contact for residents seeking behavioral health services. Treatment services for mental health, for substance use related disorders. We are the technical experts in this field. So anyone in the community, as well as providers, can reach out to identify treatment services related to behavioral health services. And in addition to that, and I'll speak more to that a little bit later on, we also seek out grant funding to fill in any gaps within services that are not Medicaid reimbursable. So as I mentioned, the role of the LBHA is to plan, manage, and oversee the public behavioral health system within Prince George's County. That includes all of the service providers that receive Medicaid funding, in addition to the grant services that I mentioned. We inspect, we license, we inspect, and just ensure that the quality of services are, tier one, services here within the county. So these are a few of our responsibilities overall, just so that you can see here, as I mentioned, overseeing the public behavioral health system. We serve as a liaison between the state behavioral health administration and our local jurisdiction of Prince George's County and the health department. We provide quality assurance through program and grant monitoring, coordinate services for children, adolescents, adults, and the elderly, authorize services for individuals who are uninsured, We do provider recruitment, offer technical assistance to providers that are coming on board within the county, that are new to the county and establishing themselves. We provide information assistance, community education. We investigate, as I mentioned, and provide a formal response on behavioral health complaints and grievances. We serve as staff support to the Mental Health Advisory Committee and local Drug and Alcohol Abuse Council, which disbanded a few years ago, and we're working to bring that those committees back together. So, certainly, Kim, you may be, and many of the folks here in this meeting may be resources that we connect with to participate on these committees. In addition to that, we manage grant funding received from the Maryland Department of Health and develop and implement a behavioral health strategic plan. Our strategic plan has been an annual plan in years past, and currently we've developed a 3-year strategic plan that's currently being reviewed by the Maryland Department of Health and Behavioral Health Administration. The Public Behavioral Health Service oversight of services and mental health services. This is the service provider array here, Public Behavioral Health Services in the mental health sector. So you have your outpatient mental health centers, your PRP programs, mobile treatment service programs, supported employment programs, and targeted case management programs. In addition, you have residential rehabilitation programs here within the county, residential treatment centers, and residential crisis beds are all a part of the public behavioral health services system for mental health services. Now we have our substance use disorder programs, and these are the different levels of substance use programs, starting with your level 0.5 and working your way through from outpatient, intensive outpatient, partial hospitalization, medically monitored intensive inpatient services, clinically managed high-intensity residential programs, clinically managed population-specific high-intensity residential programs, clinically managed low-intensity residential programs. And as in addition to our responsibilities, we have, as I mentioned, our the grant funding behavioral health programs that we work to incorporate here in the county to implement. It's a large part of our job is ensuring that we identify any missed opportunities, any deficiencies, anything that's lacking here in the community that has been identified as a need. So we often will, when funding is made available through the Maryland Department of Health, Behavioral Health Administration, we will draft proposals to get those funds in order to support the need locally. So here are just a few of our grant-funded behavioral health programs, and there's quite a few. This is the first slide here, so I can just go through them briefly. The Maryland Community Criminal Justice Treatment Program is one, Trauma Addictions Mental Health and Recovery Program, Mental Health Court Social Worker. Many of these programs are within the health department. Jail-based substance abuse treatment, medications for opioid use disorders program. Additionally, we have crisis response system services, that provide on-site emergency intervention for all ages, including assessment and brief treatment for psychiatric crises. And this includes our mobile response teams, urgent care appointments, and emergency disaster response following a crisis. We have and you can see here the mobile response teams and our 988 call center are also grant-funded programs that the LBHA works closely with to monitor and to ensure that the needs of the community are being met. Many, of course, here in this group, many understand, that 988 is the main line to receiving crisis support, suicide and crisis line support. And also our mobile response teams provide that in-person intervention immediately thereafter. In addition to that, we have our homeless prevention. Excuse me? Was there a question? I'm sorry, I can't see the group.
I don't see any questions. I think someone may have accidentally unmuted.
Oh, okay, thank you, Kim.
Thanks.
Our homeless prevention and housing services. So these are a few services, supports that we provide to homeless individuals and those that are at risk of experiencing homelessness. We have outreach with treatment services, projects for assistance in transition from homelessness, the PATH program, continuum of care, the Homeless ID Project, and state care coordination services to individuals with SUD residential treatment programs or actively engaged in outpatient services. For our older adult and elderly population, there's outreach as well as residential rehabilitation programs for this population in particular, and behavioral health assisted living. For the child, adolescent, and TAY population, there are specific services geared for this group in particular that are grant funded. Transition age youth funds are available to provide intensive residential services, skills development, and case management to individuals ages 16 to 25. There's the first episode psychosis program, in-home intervention program for children, IHIP-C, and the therapeutic nursery program, which is one of the newer grant programs. Special population services for individuals in need of American Sign Language, signing therapist. There's also the Assertive Community Treatment Program, ACT program, which is an evidence-based treatment for adults. Pregnancy Postpartum Project provides non-clinical assistance and recovery support to assist pregnant and postpartum women, as well as women with children who have an opioid or other substance-related disorder to maintain their recovery. There's also child welfare involved family services who have counselors who work collaboratively with DSS to conduct assessments of those referred and the families who are identified in the child welfare system as having a substance-related disorder. Peer recovery and support services. Again, many of these services lie within the health department. And so I will go over them briefly. There's peer support and advocacy programs, wellness and recovery centers, our adolescent clubhouse here in Prince George's County that support youth ages 12 to 17 with a primary substance use disorder, peer-to-peer programs, and a telehealth equipment pilot program. So lots of great work, lots of great partnerships, internally and also externally with many of our stakeholders, mental health and substance use stakeholders in the community. And that is it. So here is our phone number where we can be reached if you have any questions or to inquire about any of the services, grant funded services, provider services that I've mentioned here today. You can also reach out to us via email for a prompt response. And here's our website as well for additional information. And I know I've shared quite a bit. But I also know that we had, Kim, you have a robust agenda today. So I just wanted to make sure that I was able to just briefly go over, but I can certainly share these slides if anyone wants to sort of get a read through and spend some time getting to know the services that are listed.
Thank you so
Any
much. Yeah, it'd be
questions?
great to send out the slides. I do see one question in the chat. Which nonprofits are already participating?
So as far as nonprofits, I wouldn't be able to give you a list just yet, but I can certainly follow up with that information. And that's from Carmen Rivera.
Yes.
Yes, good afternoon.
Good afternoon.
Very interesting. Thank you so much.
And I can certainly provide that information to Kim to share with the team.
Thank you. Here at the State's Attorney's Office, I work with the State's Attorney's Office, Ms. Aisha Brayboy, and we're starting developing programs for the youth. In this case, I am in charge of the Hispanic youth leadership for the middle and high school students. And we are in the process of creating a virtual meeting focusing on opioids and fentanyl. And so I'm reading with very good attention your programs that you have, your grants and all that. So how do you go about it? We at the state attorney's office can apply for any, I'm sure, probably.
Yeah, so we typically send out an RFP to our provider network when there are grant funds available for a specific program that we've identified. And we share that information widely for those that would be interested in providing that service. We also
Okay.
share it on our website. So certainly, if you have an interest in something in particular, Ms. Rivera,
Yes.
I would certainly love to learn more about that. And so you're interested in knowing the nonprofits that are currently providing services under the grant funded programs.
Yes, we have heard that a lot of the school like High Point are having tremendous issues with drug abuse, the fentanyl. And so we're trying to reach to those schools now. And so we at the state's attorney level, well, we go so far, no, doing outreach, but we would like to be able, and thank you so much for the information you provided me because we can, act on that information. But since we're talking and you mentioned that nonprofits, you're not too sure. So you're making me believe that we at the different departments possibly could apply for any in order to be able to, assist. But I will get in touch with you in more detail at your email and information.
Yes, and if you're interested in learning more about the publicly funded substance use programs within the county that I mentioned, so the low intensity and other programs that provide intensive outpatient support, we can share that information as well with anyone here on the call.
Thank you.
You're welcome.
I saw one other question from Sylvia Fuentes, what are the requirements to get this these services?
And Ms. Fuentes, if you don't mind, just clarifying, you mean to obtain mental health and substance use services? And I can speak to that. So if you just give us a call or you can send us an email. As I mentioned, we can widely share the resources that are available here within the county. You can also access those resources on our website, and I can put that in the chat as well. So if you have a client, or if you're working with an individual, or if you yourself are in need of mental health support, substance use support, certainly take a look at that information, and we can steer you in the right direction. If you still have any inquiries, you can also give us an email, send us an email, or give us a call, and we can provide additional support to connect you to the right provider. I hope that answers your question, Ms. Fuentes.
No, but I can reach out to you specifically to ask about my question, because I have also been working with a lot with the Hispanic and Black population, and a lot of the times, unfortunately, these clients, they don't have a legal status. And my frustration and my challenge has been that we don't have a lot of resources for Prince George's County residents that do live in Prince George's County, but unfortunately they don't have insurance, or they don't qualify for insurance, unfortunately, and they do have to come to the safety net clinics. And sometimes some of those clinics have a long waiting list for these programs. And when I have had call directly, to Department of Human Services, they haven't been able to provide resources for me. They just similarly as in shock and confused as myself as to where these clients might be able to go.
And I can certainly identify with that as being one of the major concerns, not just for Prince George's County, but just across the state. Having services widely available, even for those that are uninsured, is a concern. But definitely, I would love to speak with you more offline, Ms. Fuentes, to see if there's anything that we can do on our end. Any other questions? I will go ahead and put the website in the chat, as well as the email information, our phone number as well, so that if anyone has any questions that come up, later on in the day, please just reach out.
Thank you so much. This is a great presentation. You all have a lot on your plate.
There's plenty of work to do, and that's a cue right there that I need to turn off my camera or something. I think this rain is about to kick us all off.
Oh gosh, I hope not. Well, thank
All
you
right.
again,
All
and
right.
we'll be in
Thank
touch
you.
about more collaboration.
Absolutely. Thank you.
All right. So moving us into kind of our next topic of the day. Oh, and yes, Taylor has been able to make it on, which is good news. I wanted to introduce everyone to Taylor Palmer, who's our newest University of Maryland intern, or recent graduate of University of Maryland, who will be taking the lead for our behavioral health advisory group, keeping us organized moving forward. So Taylor, if you'd like to share anything else about yourself, and then we can jump into the consortium.
Absolutely. So sorry to be late today, folks. The rain is also holding me up here, but looking forward to working with everyone. And we will just get on with the next part of the presentation here. I'm going to give a little bit more context about the opportunity with the opportunity that is coming across at the state level with the consortium.
I just realized I'm not sharing the slides yet. I'm sorry. I'm coming out right now.
No worries. And again, these slides will be available. There are some links for more information on the consortium. So we're just going to do a high-level overview, looking at some notes from last time. It seems like you guys reviewed a little bit of this, but again, just as a refresher for the Maryland Consortium on Coordinated Community Supports. So a lot of these goals are centered around supporting Maryland youth and their behavioral health. So as you can see, there are 4 goals have to do with supporting youth both in and out of the classroom, and then involving the families as well, and looking to this 4th goal here to promote sustainability. And so a lot of these goals are aligning with the work group. So we wanted to bring this forth to folks to see what could the work group's efforts be to go for this opportunity. And Kim, if you could take us to the next slide. So to achieve those goals that you just saw, the consortium is planning to offer 2 grant opportunities. So the first will be falling under the umbrella of service delivery, and everything that you're seeing up on the screen here, bolded, are all opportunities that this funding could go towards. So these service delivery grants will be more. They are coming up pretty soon. They'll be actually coming up this month, and we have some more information on the next slide about that. But the service delivery grants will be first, and then capacity building will be coming second. Later on, the date has not been released yet for capacity building, but we do know that these service delivery grant opportunities are coming up for organizations to apply for. So you can see that there's a lot under this umbrella that folks could apply for. And Kim, if you don't mind going to that next slide there, here's the timeline for that RFP, for that grant opportunity, again, for providing those services. So still waiting here in June. It should be any day now. That's the most recent update we received about the RFP coming. But if you are able to sign up for the mailing list, you will be able to find out when that RFP is released. So here's just a tentative timeline. So you can see coming out in June, and then the applications will be due in August. And then this first set of grants will primarily be for the 2023 to 2024 school year. So this is certainly something that is coming up more urgent, and we just wanted to put in front of the group for those who may be interested, or to see how the advisory group, what efforts the advisory group would like to take moving forward, knowing that this opportunity exists. And next slide. So here is a list of all of the links to see if you want to get more information about this. So again, that first link, the mailing list, you'll be able to get updated about when that RFP is released and next steps with that. And then there is a wonderful Zoom in which folks gave a little bit more context about the consortium, a lot better than I just did. So feel free to use that recording. We did get a notice that it's only available for about 30 days, and it may be soon expiring. So if that is the case, feel free to use the presentation slides, these PowerPoint presentation slides. It contains all of the same information that was presented in that Zoom. And if you do use that Zoom, be sure to use this passcode here. And there is a website link where you can see more information about the consortium, as well as future meetings that are coming up if anyone would like to take action in attending some of those. And so that just leads us, I just wanted to open up a few minutes for discussion. Feel free to put in the chat or unmute if you have any ideas about this consortium and what this could mean for the advisory group, what the role of this group could be with this opportunity coming forward, to possibly collaborate and see how to get some of this grant money, or help others to maybe apply for it.
Hi, Taylor. Thank you so much. I know myself and Imani are getting regular updates from the county side, from the DCAO office, around their goals for collaboration countywide. So we'll continue to provide any updates as we have them around the direction that they expect to go. Just to start off with that note. And hopefully we'll have more updates by the July meeting once this is live.
And I see Courtney's note right here, so I'm just popping these in the chat.
Kim, I just had a real quick question. I think, this is all great news and, but I was wondering, I know Amani said that there was a 3-year plan. So, with the county, do we know when that is expected to be done? Because I think it would be, again, I guess I'm always thinking about how do we orchestrate this so that we're all working synergistically together and meeting that, if that's the overall 3-year plan. Just wondering, Amani, I'm not sure, do we know when that's going to be available, or will it be after this is due?
It might coincide together, Margaret. And the strategic plan is specific to the LBHA program.
Oh, okay.
But we should have the final review shortly. There's no specific date just yet. But it's with BHA.
Would there be, I thought there was also a countywide plan for behavioral health. I mean, I didn't know it was just LBH. I thought it was the health department as well.
Yes. So separately, the Office of Assessment and Planning, we're working on the Community Health Improvement Plan. And that is also a 3-year plan, which could be a little bit confusing. So that plan is based on the results of the community health assessment. And it's not just behavioral health, but behavioral health is one of our identified focus areas.
Thank you.
With that said, I think that for the timeline for that strategic planning internally, we're aiming to have goals for this work group finished up through the summer. So there's a little bit more flexibility. And of course, we can add things over time. So if we do identify a place for collaboration within BHAG, we can add that into our strategic plan moving forward in our work plan.
And we would like to transition to the strategic planning, just in the interest of time. If folks have any more ideas, feel free to pop those in the chat or mention it as we go through these goals. So as Kim was mentioning, on the agenda for this summer is specifically this work plan. So in talking more about strategic planning, so I just wanted to bring forward these 4 goals that were previously identified by the group to see how we were feeling about these goals, to move forward, and to see if we could start talking about making these a little bit more specific. So talking about some specific objectives, some specific action items that will lead to these goals, just so as we do look to that work plan that we hope to achieve over the summer and present later on in the fall to get the ball rolling on that. So again, just to remind folks, so one of the primary goals here was to promote the integration of the behavioral health in these community programs in schools in Prince George's County. Second goal was specifically focused on justice-involved individuals. And third goal was to support emerging behavioral needs. And then the fourth goal, increase utilization of health benefits for individuals in PG County. And I just wanted to also remind folks, Kim, if we could go to the next slide, of some specific steps that you guys had mentioned last meeting to maybe help achieve these goals. So just to remind folks from the meeting notes last time, so you guys talked a lot about collaborating with diverse stakeholders in different groups. So working with the school system, folks in the criminal justice system, the LBHA, and then the Integrated Health Work Group, which is a subcommittee in the Healthy Eating, Active Living work group. Second, you guys uplifted some goals around data collection. This included looking to specific data sources that were more up to date, identifying gaps in programming, and then also creating a dashboard to then translate and be able to disseminate data. Uplifted as well the stigma around mental health, and so talking about a social marketing campaign to raise mental health awareness. The development of a referral program or network. If anyone would like to come off of mute at any time and give a little bit more context to this one, that would be very helpful, just from what I was trying to summarize from our notes here. So if anyone had any ideas about that. And then as we were just mentioning with the consortium, talking about grant applications for funding. So how do folks feel about these strategies from last time? Did anyone have any thoughts that came up after the meeting about any of these bullets that they wanted to raise now?
Hey, this is Kim. I feel like I know we had a lot of discussion around the first bullet, and I feel like that fits really nicely into the previous goal for promotion of integration of behavioral health and somatic care. And there seemed to be a lot of existing efforts that we could participate in, like the consortium, and then the efforts with the integrated health work group. So I feel like this one is still relevant to continue on. One thing that I feel like is missing in our goals, if we're thinking about what updates we want to make for the future and considering the results of the community health assessment, is something specifically focused on substance misuse and overdose prevention. But what are everyone's thoughts around that? I'll go back to the strategic planning goals so we can take a peek.
Kim, this is Courtney, addiction nurse practitioner at the Methadone Clinic. I concur with your statement regarding that. So I'm just really vetting what you said, the need to add that to the goals.
Excellent. And I think we can, with everyone, we can explore like what strategies might be best to address that, but whether it be, and since we have people on the line, expansion of naloxone saturation or in line with, or implementation, I think it's the STOP Act for naloxone saturation in schools and just availability at hospitals and other social services departments. And maybe, and I know Dr. Somerville's within Dr. Somerville's group in behavioral health services in the health department. She's just hired a chief for their substance misuse sector of the health department. So hopefully we can do some participation with whatever grants they have, maybe for harm reduction or just really a goal of reducing the number of deaths experienced.
Kim, I like that. And I also think we should put some emphasis on youth, particularly the Latinx community, because they've been affected. I know last fall there were incidences of fatality among young people. So if we can just put a little caveat, with some strategies around youth, that would be fantastic.
I agree with that. I have a question, and I don't know if this is the correct time to pose it, but I know they do have school-based wellness programs throughout the county, and throughout Maryland. Um, is that one way to partner with educating youth and adolescents, regarding the substance use?
I think absolutely. I know there has been some, so those programs are primarily run, I think, by the Health Department Family Health Services, and the there's some partnership with FQHCs who help manage those, I believe. So we could absolutely do some outreach with them and see if they have any existing programs, if there's a way for us to help expand on those, or just get resources and services to them.
Yeah, absolutely. Because I did serve briefly in the school-based wellness program, and it was pre-pandemic. So I know at the time we didn't have any programming, but it's very pertinent that we address that. That's one avenue that we can address the students directly.
Hello, this is Carlos with TLC Maryland. Just really want to just kind of give credit to the raising of awareness, and just kind of also add on to that with an emphasis of, these children are, constantly getting messages through music, through their peers, through TV, through people on the street, really trying to push these substances on them. So I really like the efforts of increasing awareness, and kind of being a voice to match all of the other efforts and distractions that they're getting. So anything that we can do to support raising the awareness and of services, and the awareness of the health potentials, that can come with abusing these substances. I think that's something that's really important, just to kind of match the intensity of the messages that they're getting in a negative way.
Thank you. Yeah, I agree. And I know we mentioned, yeah, something focused around stigma as well, so that if someone is having trouble, or that they aren't afraid to speak up.
And Kim, this is Margaret Fowler from TLC. I think the one thing that's really wonderful that I'm seeing here is, I think it takes a village, right, to help our children in many, many different venues and aspects, and different angles. So really here working collaboratively with existing programs that strengthen each partner, and solidifying maybe a different angle, or that we can approach these things, I think is the key as well. So, breaking down the silos of the individual programs, and each individual needs different things at different times. And, unfortunately, I look at it similar to like a spoke in a wheel, right? They can come in one way, they get to a point, they may then go out again and then come back in. But we need to have that kind of collaborative support with the spokes around our program, so that we catch them before they get totally out of the middle of the support system.
So with that, I'm hearing a more collaboration, something that aids in that matriculation, that keeps organizations like this together, and therefore can help individuals who are going through the process stay in the process at different stages. Am I capturing that right?
Yeah, Taylor, and I think, with anything, we all have, I think the more that we come together as a unit and a unified community, bringing all of our strengths together, and reducing duplication, where, people, and pulling the strengths, right? I just think then you're, and unifying the message. I know, that way they hear it again and again they may go to, this after school activity. They see and hear the same message. They may see it in school. They may see it at, a basketball game. They may see it on the street when they're going to a store or, I think those kind of unified community messaging consistently re-emphasizes and reinforces what we're trying to say. And it reduces costs, right? We're all sharing the same messaging. We're utilizing funding to spread that messaging across a larger audience. So, it's a lot of that. And there's not, people getting confused because sometimes all they need to hear is one different word or framing it a little differently. And they're like, it confuses them. So, I think in those types of things and having forums like this to be able to discuss and, come together and have that unified messaging and integration so that we all feel that we're being heard as individual organizations, but unified, having a much bigger impact.
That's actually something we've been talking about a lot in the health equity work group as well, is just building this communication force in the county that gets the message out, make sure that it's accessible to all of the different people in our community, how they like to receive their messages, that the health literacy is on point. So I think that's great, and it could be a really good point of collaboration with that group as well.
Any additional reactions to that? And I was curious if anyone, sorry, go ahead.
Okay, this is Carmen Rivera again with the State's Attorney's Office. Maybe it could be an opportunity to invite the Prince George's Public Schools board. They also control, well, not control, but they are there to support the schools. We get a lot of concerns, complaints from parents about bullying and about a lot of drug abuse in the bathrooms, and the principals and admin support not being able to help, to be able to assist them. So we really need to start focusing on that through the strategic point of substance abuse, and like you mentioned, the grants and the development of a referral network, because I know there are many nonprofit organizations. They should be participating in this type of how do you call it, virtual meetings, because at the end of the road, it will be helping everybody. I mean, especially the schools, no? The children, the teens. Thank you.
And this is Imani Booker Lewis. I just want to second that notion, and just to also, just make everyone aware that the LBHA is also interested in knowing, how to really connect to our, our youth and to the TAY population, which is about 16 to 25, depending on who you speak to. So it's because there's apps nowadays. There are other ways of accessing information, and so while we have a wide service array of providers, and we share, via email or via the website, it doesn't really mean that the community, especially our youth, are able to access it readily, and are well informed as to where to go to get this information. So we've been doing presentations in the community, and with the school system as well. But we're also interested in knowing other ways in which to connect and message to our youth, to let them know that these resources are out there.
So it sounds like another strategy to add is centered around this communication plan and making sure that, again, bringing in other stakeholders and making sure to bring in providers. And that leads to, I was just curious about the referral network. Did anyone have any other strategies around this? Seeing how to develop this, what goal this may help to achieve as we look ahead to the work plan?
Do we have a directory? And I know the LBH has the, the overarching directory of all the providers, but do we have a how-to directory on what to do if you run into this case? It's just more user friendly, I guess, like that you can go into and read, like, okay, I have kind of what, and I'm sorry, I don't have the name pulled up, but one of the other participants mentioned earlier, it's just like, how do we connect? I think this Rivera, but Rivera was mentioning how, she don't know necessarily where to go. But it sounds as if we need some type of who to directory. And I don't know how to actually create that diagram. But at this point, it sounds like everyone needs to know where to go when they run into certain situations. Do we have that in place? Again, I'm not really too abreast to all of the services that we have.
I think that falls under the social services, or maybe social services and family services, maybe. But what the previous lady mentioned was about the application for the youth. There has to be a way that we can connect with the youth directly.
Got it. Thank you for that clarification.
Yeah, I know on the coalition website, we do have, and I can put a link to it, in behavioral health. We did have a list of a sort of directory, but I don't think that it's as complete maybe as to what you're talking about.
Okay. Yeah, that was amongst us in terms of the directory, but in terms of the youth, as I brainstorm, youth is very highly influenced by their peers, and then secondly by social media. So that mass message that we're sending out, I think we may even have to have a way to promote it to where the youth would actually pay attention to it on social media.
Agreed. Taylor, if you want, I can is there a specific goal that you think I need to stop on, or should I kind of go through these? Do you think we've covered some of the big items?
Yeah, I was just gonna invite folks, as we flash through these, if you see any things that you wanna lift up, feel free to mention. So, but Kim, I know we are nearing time. So folks, we will send out these slides with each of these goals for further review, and also type up in the notes some of the ideas. And of course, if anything comes up, feel free to let us know, or feel free to certainly mention. Next meeting, we'll be focusing on this work plan. Kim, if you don't mind showing that next slide with the timeline for our summer plan. So again, looking to August, planning to have a draft of the work plan. So we will focus in our July meeting on solidifying more of the goals and more of those strategies. And then in September, the goal is to have a presentation of the work plan at the quarterly meeting. So again, and then in between there, we will be sending the work plan for the group's feedback. So do let us know if you have any ideas, or certainly do bring those to the next meeting. And your next meeting is going to be on July 19th. And do we have any community updates that anyone wants to give, either in the chat or come off of mute? Alrighty, well, certainly do email as needed, and we will be in contact with the recording and the meeting notes. But thank you so much, everyone, and have a wonderful rest of your day. Enjoy the rainy day.
Thank you, Taylor.
Thank you.
Thank you to everyone.